Hi, welcome to the brand new episode of Your Diary. At some point of time, everyone would have felt need for a trained, licensed professional to work out our emotions, feelings and problems that are way out of our control. To assist us on this, we have with us Dr. Meera Shruthi, Assistant Surgeon, District Hospital, Idiki. Hello doctor, welcome to our show. As I've already mentioned, I don't know in scenario there would be anyone who has never felt a panic attack or an emotional outburst or a stress headache. How often do you see these patients in your clinic?
As Dr. Noushin said earlier, adolescent time is a time where you having lot of chances, challenges, experiments and explorations. During this time you have lot of explorations, psychosocial explorations, then social stigmas you are facing. So all this will put adolescents into a situation where you have lot of stresses. These stresses can precipitate lot of problems. I think you have lot of problems to ask me. Most welcome.
Exactly. Let's go to the first question.
Hello doc, my name is Jens. I'm working at UST Global and my question is what are the health issues if I'm skipping my breakfast regularly?
Okay, breakfast is an important meal for anyone. It just breaks the fasting period. When you have your dinner, then a lot of time you are sleeping, then you wake up and you have the breakfast. So it just breaks the fasting period. So what is the use of breakfast is that it just replenishes the energy source in your body to give more of glucose to your body, other nutrients, etc., in order to keep your energy up during the daytime. So most of the times these adolescents skip breakfast. Maybe because they are not getting the breakfast, readily available breakfast, or if they are not bothered to take any breakfast, or most of the times what they will do is they will try to be in bed rather than having breakfast. So skipping breakfast is a major problem. It can actually lead to lot of problems during adolescent age groups, such as they can lead to poor performance because high energy breakfast can keep you healthy during the daytime. You can involve in lot of activities without any fatigue. Other thing is that there are certain studies which have been shown that those who are regularly skipping breakfast become gaining more of weight. And one more thing is that if you are skipping your breakfast, mostly they will go for some junk foods. They will go outside and eat some snacks during your morning time. That can lead to severe other health issues. So it is better not to skip your breakfast. Have your breakfast regularly. Be healthy always.
So viewers, if you want a healthy life and a good performance, don't skip breakfast. Let's go to the next question.
Hello doctor, my name is Renit and I'm working in UST Global, and I have heard like once you start smoking, you can't really stop. Is it true?
Yes. Most of the adults have this doubt, like once you have started smoking, you can't stop. Smoking is a very it's a habit which is very hard to stop. It is because of the addiction caused by the nicotine, which is you are usually seeing in this cigarette products. So these teens will start their smoking habits because their family members or friends will start to do things. They will see this and they will try to pretend as adults.
Or just in a social circle, just to
they just try to. The most common problem among teenagers is the peer pressure. They always try to imitate their friends or family members who are very very close to
whom
them.
they consider as a role model.
Seriously. And this nicotine, this is a very hazardous thing which is present in cigarette products. This can act as both as a stimulant as well as a depressant. As a stimulant, it can initially increase your heart rate, which can keep you alert. So you will be feel more energy when you are having cigarette for the first time. But later it can lead into depression and fatigue. So these are the withdrawal symptoms. So what the teens will do with this fatigue and syndrome, they will think like, oh, I've just started my smoking, so I can't quit from this smoking, so I have to take another puff to get rid from this problem. So they will go for another puff of cigarette to just spur from this problem. But don't worry, there are certain tips that you can get rid from this problem. With the right approach, you can definitely quit smoking. The tips including, first of all, you have to set a date when you are quitting the smoking. Just throw away whatever products you have, the cigarette products. Even drug abuse persons can use this method. You can just throw away the cigarettes or whatever drug you are abusing, just throw away. Just write down what are the triggering factors which is leading to you to take a smoke. So just write down the triggering factors. Just try to avoid the triggering factors. One thing you have to remember is don't quit in a moment, or just suddenly don't quit from smoking. Just try to quit from smoking gradually. That is the one thing you should remember. And alternatively, you can use some nicotine gums, patches to reduce your craving for smoking. These are the few tips you can remember to quit smoking. And most of the times, if you aren't able to do things perfectly, you can ask a help of your medical practitioner to help you in quitting this smoking habit.
I'm sure these are very useful tips because smoking is a serious health hazard for everyone. Let's go to the next question.
Hello doctor, my name is Babul and I'm working in UST Global. My question is that what are the side effects of crash dieting?
Crash dieting is something which every adolescent will always try to do. This is because of the negative body imaging they are getting during their adolescent age period, because they will try to imitate, most of the times they will try to imitate some film stars or some role models as they are seeing along with some friends or some role models. They just try to be like them. So what they used to do is just the crash dieting. So crash dieting is something very very problematic one. That can lead to some serious health hazards. Not even immediately, but later they can cause so many problems. The major problem is when you are taking crash diets, your body is deprived of nutrition. So this nutrition deprivation can lead into a lot of problems like early osteoporosis. Most of the teens we are encountering lot of problems like muscle pain, bony pain. They usually came to OPD with lot of such problems. So mainly when we are taking the history from them, they will tell like, doctor, I am just skipping the breakfast, or just I am just taking a crash diet. So the body will not be getting the sufficient nutrition as since they are in a age group where the body is growing both physically as well as mentally. So they won't be getting enough nutrition from the diet they are taking. Maybe a deficiency of calcium is there, deficiency of iron is there. So they will be definitely getting some muscle pains, bony pains. And the other thing is crash diets will lead into severe headache, because diets give sufficient nutrition to your brain. So if you are not taking your food regularly, or if you are not taking sufficient food, it can lead into reduced level of glucose in your body, which can lead to headache. Other problem is it can lead into heart problems, because sudden metabolic changes happening there in your body, which can lead to sudden heart problems. Arrhythmias can occur, sudden death. Even sudden death is reported in teenagers who are going for crash dieting. Other thing is this can lead them into eating disorders like purging, binging, as well as emotional eating, because once they just started their crash dieting, if they are finding it is not at all going good, they will go for, oh, I am not getting the effect from my crash dieting. They will go for another binge eating that can lead again into emotional eating and lead into later problems like obesity, then diabetes mellitus, hypertension, hypercholesterolemia. All that problems can occur. Even the vital organs may shut down because of this crash dieting. So it is better to avoid crash dieting, rather go for a healthy nutrition diet.
As you were mentioning about crash dieting, just the other side of the coin, like emotional eating, where you eventually will put on, how to deal with it and how to avoid this?
Okay, somehow we are all emotional eaters, but it creates a problem when this emotional eating will lead into a long-term problem like weight gaining as well as purging or binging. So emotional eating is a greater problem among adolescent age groups, because when you emotionally eat, you will eat more of high fat food, which is less in nutrients, less in proteins and other minerals. So this will lead into weight gain, suicidal tendencies, because they are just eating maybe the underlying problem may be a depression or anxiety, so that can lead into suicidal tendencies, headache, insomnia, that is sleep disorders can occur, and long term they can develop into diabetes mellitus, hypertension, hypercholesterolemia, even gallbladder diseases they can have, and muscle and joint pains they will get. So these are the major health issues if you have this emotional eating. So emotional eating is something which everyone knows, I am eating emotionally, but it is very hard for them to break the emotional eating cycle. So there comes the nutritionist as well as the psychologist. The psychologist can help you a lot to find out what triggers you in emotional eating. So if it is a stress factor or something else, they will find out and they will help you. Otherwise the nutritionist is someone which can alter your eating pattern, so they can help you a lot. Along with this, you can seek help from a medical practitioner also.
Okay, so you mean to say that there is a cure for this?
Yes, definitely.
Okay, let's go to the next question.
Hello doctor, I am Nikhil. I am working in TCS, and my question is, junk food or fast food is becoming a stable part of our lifestyle. So will it cause long-term health issues?
Okay, junk foods that is mostly contains high amount of fat, both saturated and unsaturated fat. It contains lot of sugars and salts. It contains less amount of fibers. It lacks nutrients like iron and calcium. So what happened is this will given in high amounts, which can give lot of calories, lot of energies to the teens. Yes, at a time they will be getting more energies at a time. So what happened is all these things can cause lot of problems during their later life, even though they are not getting anything at present. So this can lead into problems like diabetes, hypertension, hypercholesterolemia, constipation, and also poor concentration, because the brain is not getting the sufficient food. That can lead into poor concentration. So definitely these junk foods are a notorious one, and mostly someone if you are hearing this, I have already said sugary fizzy drinks causes problem. Not only this sugary fizzy drinks, but non-sugary drinks can produce acidity that can lead into lot of bone as well as dental problems. So it is better to avoid junk foods or fast foods.
But ma'am, nowadays in market we are getting a lot of low calorie junk foods. Yes. What is your view on that?
Whatever be, it is the junk food. Just remember that whatever be it is, we don't know what is the ingredient is. The purpose of junk food is to give you more energy. So the teens will eat this junk foods to get more energy rather than going for homemade foods, or they just make it as a part of their lifestyle to show off. Yeah, seriously, to show off having.
So all this can be just unnecessary hype.
Yeah, seriously, because taking one pizza or burger, that is enough for a day. Some teens will think like that. So that is not a good actually. That is not at all good actually, because body needs various nutritions like iron, calcium, and fiber. Fiber is very much important for your body. And the nutritional food is definitely help you lot in your daily performance, to increase the body activity, your mental ability, your performance definitely depends upon nutritional foods only. Junk foods are definitely contains lot of fats which are not at all good for your body, as well as they are deficiency of iron and calcium, some minerals. So it is better to avoid junk foods, whatever be it is, even though, as you said.
Yeah, nothing can beat our idli, dosa.
Yeah, definitely.
Chapati and all.
Yes. The homemade foods are very much important for your body. For it replenishes a lot your body.
Okay. Doctor, we have received a lot of mail from our viewers. Some are selected. This is the first mail. I am a student and having headache almost all the day. Till now I haven't consulted a doctor. Is it stress induced or something else?
Okay. Headache is a major problem that the teens are encountering. We are getting lot of cases in our OPDs like, doctor, I am having headache almost all the day, so I can't go for my schools daily, so I am getting lot of absence in my school, so I can't concentrate on my studies. So this is a major problem most of the teens are encountering. Headaches may be either a primary headache or maybe due to some secondary causes. The teens are mostly getting this primary type of headache. This primary type of headache mainly contains this stress-induced headache and the migraine type of headache. This stress-induced or the tension type of headache, we can say it is a tension type of headache, can be of two types. It can be either episodic one, that is it occurs less than 15 days in a month, or it can be a chronic type of headache which can be more than 15 days in a month. So whatever be the headache, it is a greater problem for them. You can't point out any cause that is causing your emotional headache, I mean your tension headache or your stress induced headache. You can't point out a single problem because adolescents having a lot of psychological problems, stresses, that anything can precipitate this. And mostly these headaches are not only associated with headaches only, they can have other problems like dizziness, fatigability and poor concentration. Pains at various regions of your body like neck pain, back pain and abdominal pain, then anxiety, sleeping disorders, all these can be a part of this stress induced headache. Another thing is that migraine type of headache which you are getting intermittent and they are severe throbbing type of headache associated with the nausea. Sometimes people try to avoid lights and talkings, some odors that can also precipitate sometimes this migraine type of headaches. But there are some, you should know there are some secondary causes your headache like this visual problems. That is a greater problem among adolescents, visual problems. Usually these teenagers definitely they are using computers a lot as well as the mobile phones. They will be definitely having this visual problems. Another thing is the hormonal changes. Hormonal changes somehow which is rampant among adolescent girls is that during menstrual periods they are getting headaches. So they will be always worried about this headache because this estrogen changes, that fluctuant estrogen levels in your body will be causing this type of headaches. Another thing is the foods which are skipping. If your brain is not getting sufficient nutrition, that can lead into headache. So these are the some secondary causes of your headache. So it is better to go for a medical practitioners rather than using analgesics at the time of your headache in order to rule out what is the cause of your headache. It is better to go for a medical practitioner.
Okay. Let's go to second mail. I'm a teenager having severe acne problem. Is it due to my food habit or how can I get rid of this?
Okay, we are getting so many queries about this from the teenagers that whether my food habit is related to my acne problem. Definitely this is a issue of debate for a long time. Whether food habits are associated with this your acne problem. Usually the acne during adolescent age is not due to food habits, but it's not purely related to food habits, but it can aggravate your acne problems. It is definitely due to the hormonal changes that is occurring due to puberty. But you can use some fresh tips to reduce your problems, like you can wash your face intermittently. Then if you are using some hairsprays or gels, to reduce the use of it, doesn't allow it to come to your face. Then you can even have some OTC product, that is over the counter products you can use. But some teens always tells like I'm using some face creams, but it is not at all useful for me, doctor. So in that case you can come to some medical practitioner where you can where we can give you some oral antibiotics if the problem is so severe, and we can give some antibiotics, local topical antibiotics like doxycycline as well as isotretinoin. So don't be so worried about your acne. It is a part of your physiological changes happening during adolescent age.
This was quite a valuable session. You have given a lot of tips regarding how to tackle acne, emotional eating, binge eating and all. All your further queries will be answered to youthdiary@rosebowl@gmail.com.